Hello guys, my name is Leon and I'm a student at Kaiser University. And today I wanted to talk about a disease called ALS. ALS is also known as Lou Gehrig disease. Um, the reason I chose this disease is because my grandmother, she passed away from it. And I remember as a child, this was really hard for myself and my family. Um, I remember seeing my dad cry for the first time. Um, I remember it happening so quickly. She started with slurred speech, difficulty walking, falling over things, not being able to eat. Symptoms began to worsen. Um, I remember helping her to the best of my abilities, and I couldn't do much about it. ALS is a neurodegenerative disease that damages nerve cells in the spinal cord and brain. This is a disease that causes your muscles to waste away because of lack of nourishment. When a person's motor neurons pass, the brain fails to take charge, which then causes muscles movement to drift away. There are two types of ALS. One is hereditary and the other is sporadic. Sporadic is the most usual to occur in the US, which typically affects 90 to 95% of instances. Scientists believe there are many possible causes of ALS, such as gene mutation, chemical imbalance, disorganized immune system, and protein mishandling. Other environmental factors may spark this disease, like smoking, environmental toxin exposure, and even military service might lead to ALS from certain metals, chemicals, viral infections, and dramatizing injuries. There are several complications a person might undergo, such as breathing problems because of paralyzed muscles, speaking problems, which may start with slurred speech, then eventually get worse. They may have eating problems and require a feeding tube because of muscle damage, not being able to swallow. This disease may lead to dementia, where a person's decision making may be altered. Although there is no cure for ALS, there is a drug by the name of riluzole that can reduce damage to the motor neurons by reducing the release of glutamate. There are a few therapies a person might undergo to reduce the amount of everyday complications, such as breathing care, physical therapy, occupational therapy, speech therapy, nutrition support, and even psychological and social support.